You're listening to Be Health Connected, a podcast by the St. Louis Area Business Health Coalition. Your host for today's episode is Lauren Remsbecker, BHC Senior Director of Member Engagement and Communications.
Hello, I'm Lauren Remsbecker, and welcome back to the BHC's Be Health Connected podcast. As patients, we all hope that the hospitals and outpatient facilities that we choose will provide the best care for us and our loved ones. But the reality is that quality, safety, and outcomes can vary dramatically depending on the facility. That is why transparency is so critical in ensuring that patients and purchasers of healthcare have the information needed to make important decisions. For this episode, I'm pleased to be joined by Leah Binder, President and CEO of the Leapfrog Group, a nonprofit watchdog organization that for the past 2 decades has collected, analyzed, and published safety and quality data in order to push the healthcare industry forward, encourage better care choices, and save lives. Leah, thank you for taking the time to join us today.
Thank you, Lauren. Thanks for having me.
So for those listeners that may not be familiar, would you mind elaborating on the Leapfrog Group's mission as an organization?
Sure. We're a nonprofit. We were founded 20 years ago by business leaders who were very concerned about errors and accidents that were happening in hospitals that were, in some cases, killing their employees, but certainly harming them. And they formed Leapfrog as a way to get more visibility in the country on how hospitals were doing, which hospitals were excelling at quality and safety for patients, and which hospitals had some work to do. They felt strongly that all of us as patients deserve to know that information before we end up at hospitals. So that was the goal of Leapfrog back 20 years ago. They said we should publicly report on the quality and safety of these hospitals. At the time, that was considered a little bit of a quixotic mission. Come on, you can't get that information. It won't be fair to compare hospitals. We don't know. People aren't interested. There were a lot of skeptics when Leapfrog was founded. But now, 20 years later, it's much more accepted that there's public reporting around quality and safety. And really, Leapfrog had a lot to do with that over the time, advocating for more transparency in healthcare so that we have the information that we need to compare, and then actually reporting that information. So Leapfrog collects the data, working with our partners like your coalition, working with our partners to collect information on safety and quality and publicly report it throughout the country. And that's been very successful, and we hope more successful in the future because there's a lot more to be done.
Right. And I think that really sets the foundation for today's conversation. And as you know, our members make up primarily self-insured employers. So I'm just wondering, employers as purchasers of healthcare, why should they be concerned about hospital safety and some of the medical errors that you have discussed already?
Well, there are approximately 500 people a day in this country who die from a preventable error or accident in a hospital. So the sad fact is that safety problems in hospitals are far more commonplace than most of us know, or most of us want to know, to be honest. It's a hard fact, that I hate having to convey, but it's important that we do, because people are really at risk at some hospitals. Some hospitals are better at protecting their patients than others by far. When we look at the data, we find that the hospitals that do poorly in our data, those that we give D's and F's to, are twice as likely to kill their patients from preventable errors than hospitals that do well. And in addition to just the human costs of that, and those are the extremes, by the way, killing is the extreme, everything in between, the harm and the suffering that people go through with preventable accidents like falls, or when people, which can be very dangerous to people who are in a vulnerable state to begin with at a hospital, or the getting the wrong medication, just the getting something going wrong in surgery, an infection. All of those things are very harmful. If they don't kill you, they really cause suffering, or they can really cause suffering. So we are really looking at how do we give people a sense of which hospitals are best at protecting their patients for those, in addition to the suffering and harm and sometimes the death that results from these is the cost. And in that area as well, we've estimated that employers pay something like $8,000 per admission for all their admissions to hospitals. $8,000 per admission goes to the cost of those errors and accidents and injuries. So there is also a cost issue, but I think fundamentally, of course, we all want to just prevent that harm from happening.
Those statistics are absolutely stunning, and I think really emphasize the need to pay attention to some of this information. And we all know that data is really a cornerstone to the work that Leapfrog does. So would you mind maybe elaborating on the type of data you're currently collecting from healthcare facilities?
Sure, we are collecting data that it gives us information on a hospital. And by the way, an ambulatory surgery center. We now collect data on ambulatory surgery centers as well that you can't get from your claims, and you can't get it from public sources like, say, Medicare. You cannot get it anywhere. That is why we are asking for it from hospitals and ASCs to provide that information to us voluntarily through the survey. We have an annual survey, the Leapfrog Hospital Survey and the Leapfrog ASC Survey, which gives us information like a standardized C-section rate, cesarean sections. Now, cesarean sections, when I was pregnant 20 years ago, the first thing I wanted to know was, what's the C-section rate for the hospital, and where can I find the lowest C-section rate, which hospital? And that wasn't available, even though so many people want to know that. All the mothers that I knew, all my friends and colleagues who had babies, they all want to know that, but we couldn't get it. Well, 20 years later, your only source for that information still is Leapfrog, because we ask. And we ask in a very, very structured way. So we're not just saying, what's your C-section rate in general? We're asking for a specific C-section rate that allows you to compare a teaching hospital, let's say, or an academic medical center with a rural hospital. It's the same measure. You can compare them apples to apples. And that's very useful information for people. So other kinds of things we collect are infection rates, very important, hospital-acquired infections. We look at a number of factors that can affect how a hospital maintains safety for its patients. So for instance, nursing workforce, hand hygiene, and whether or not they are effective in using information technology to monitor medication errors, which are the most common error made in hospitals. A number of other categories that we ask about, all of which have very significant impact on your safety in a hospital, on the quality of care you're going to get, and on the cost effectiveness of your care.
And thinking back to the employers that we mentioned earlier, I'm wondering how they might be able to use the Leapfrog data as a part of their healthcare and benefit strategy when they're trying to make some of these decisions around the care provided for their employees.
I think it's very important for employers to take a look at this data in a variety of ways. So one, they can simply let their employees know, here are the hospitals, here's the Leapfrog data. They can simply link to Leapfrog. All of our data is publicly reported, and say, take a look at these hospitals and these ASCs before you seek care. You should be focused on these. These are important. Some employers include information about safety in their wellness fairs and information about how they can access that information through Leapfrog. So that's one role that employers can play. They can, by the way, also ask vendors to help them with that as well. Many employers use vendors like Caslight or other organizations to report out, or they use their health plans to report out information. They can ask those vendors to please report Leapfrog, make sure their employees know about Leapfrog, because we want to make sure they're fully informed before they seek care. So that's a first thing that any employer can do tomorrow. Another thing you can do is structure your benefits so that they reward excellence. The cost impact of poor quality and bad safety is really significant. It's not always apparent on your claims, but the evidence is is crystal clear, and Leapfrog has provided lots of tools to help you find that evidence yourself. But it's also just crystal clear from just from common sense. I mean, you don't, if you get an infection in the hospital, you're going to be there a long time, and it's a terrible thing. It's going to be suffering for you, and it's also going to be very costly. So employers can start to reward hospitals that do better on those kinds of factors, like infections, or like Leapfrog's overall hospital safety grade, or some of the individual metrics within Leapfrog, like maternity care. You can say you're going to have a lower deductible if you go to a hospital that meets Leapfrog maternity care standards. Those are going to give you the best outcomes and also most cost-effective outcomes as well. So you can use it in payment and you can use it in public reporting. Those are just the fundamental tools that any employer has and can work with vendors or do it on their own, but really can think through how they incorporate that into their overall purchasing plan, which will in fact give them better outcomes for their employees and much more cost-effective care.
I agree wholeheartedly, Leah. And as one of the services that BHC has provided in the past is providing data on some of the safety and quality metrics at employer benefit and health fairs. And it's always so interesting to see the wheels start turning in the employees' heads as they start to recognize that, not all hospitals, not all facilities are the same, and that they as a patient really do have a choice in where they can go get to their care.
Absolutely. It's really important for people to know that, and to know that for their loved ones as well. Many people are caregivers of loved ones. They're spending time in a hospital as visitors. It's important for them to know as well where they can get the best care. And even if they decide, I'm not going to forego care at this particular hospital just because they didn't do well on a grade or they didn't do well on Leapfrog, still, I know that many employers and certainly many employees can talk to the hospital personnel or leadership about the care and about the Leapfrog performance. It's very important that people speak up. If you know someone on the board or you know a nurse who works at that hospital, talk to them and say, I noticed that you didn't do that great on maternity care and Leapfrog, and what are you doing to improve on that? Or you didn't report to Leapfrog, you declined to report to Leapfrog. Why is that? I'd like to see better transparency from your hospital. Those conversations as well can be really impactful and can definitely lead to major improvement in the hospital, which is a service you can do not only for your own family, but certainly for the community at large.
Yes, a great point. And as I transition to this next question, I just want to start by congratulating the Leapfrog group, because you all are celebrating a very important anniversary, your 20th this year, which is a great landmark to reach.
Thank you.
Wondering, how do you think that healthcare has been impacted by your work over the last 2 decades?
Well, I think that for one thing, patient safety is on the map. Patient safety is now talked about publicly in a way that it never was before. I've been in healthcare as a career for a long, long time, longer than Leapfrog's been around. And I can tell you that nobody ever talked about safety as something that you would discuss with your patients. It was considered something that kind of people in the know in healthcare would talk about, but others never did. In fact, there were many hospital leaders who would say, oh, we can't talk about that publicly. We don't want the public to know that these things can happen. Like, they don't want to talk about infections or never events that do happen in hospitals, but they don't want to talk about that because people will get nervous and they won't want to come to the hospital. I mean, there was just this sense that you can't talk about it. And I think Leapfrog wanted to change that, because of course you have to talk about those things if we're going to make change, we're going to make improvement. And also, they do happen. Patients are affected by them more than anyone else. They need to know this is a fundamental importance to any one of us who could potentially be in a hospital tomorrow. We deserve to know this. We need to know this. And so it was very important to us to shine a light on that. And I think that's been one of the great achievements of Leapfrog, has been to shine a light on it, to get this conversation out there publicly, and to have hospitals start to talk about this publicly with their boards, with their public, with the communities that they serve. Many hospitals that do well on our hospital safety grade advertise it you'll see banners. They got an A. They're very proud of it. That's a good thing because they are telling their community that patient safety matters to them, and this is what it is. So they're shining that light right on themselves, recognizing the achievements of their own team and their own staff, which is an important thing to do, and also educating their community about how hard it is to be safe and how important it is to be safe. So I think that that's been a big achievement of Leapfrog. So the overall movement toward transparency, which I talked about earlier, I think as well is one of Leapfrog's achievements. We share that achievement with others. I will not say we're the only ones, but we are a major force in the movement toward what I would call the routinization of transparency. We suddenly think of transparency as something we should expect from healthcare, which is very, very different than it was 20 years ago. 20 years ago, that was never expected. But I think now there's a sense, well, we deserve to know not only how hospitals are doing from a quality point of view, from pricing point of view, everything. We need to know everything. We deserve that to be made public. And Leapfrog, through our advocacy efforts with both Congress and with CMS, has been extremely effective in making that case, in bringing the right players to the table to make that case together. And I think that it's made a real difference. So both our advocacy, then also just the fact we did it. So we didn't just say, oh, it's a good idea if Congress would make sure that we have this data publicly available, but we also went out and did it. We said, let's just ask the hospitals for it through the survey, and let's publicly report that data and make it available to the public, which we did. We did it early on. We continue to do it every single year. So both actually showing how this can be done and advocating for it at the national level, I think has been a real achievement of Leapfrog. Again, we've done that with major partners, including your coalition, but including the purchasers who've been involved with your coalition as well. We've done it with a whole variety of partners, but I do think that that's something that the movement that Leapfrog signifies has been important to the progress of our healthcare system and is critical in the coming years.
Yes, there are just so many reasons to celebrate, and I completely concur. As a regional leader in the St. Louis market, we have seen such tremendous strides just amongst our own health systems in wanting to be a part of these conversations and really trying to advance their efforts and using that data, as you said, as a differentiator in the marketplace, making that more publicly available. I think as we transition to sort of our closing thoughts here, it's a good opportunity for us to reflect on some of your priorities for 2021 and beyond. What can we expect from Leapfrog in the future?
Well, our first priority for the future is to ensure that we have 100% participation in Leapfrog surveys. We need to have the full range of information that's important to purchasers and consumers available publicly. We're not there yet. We have in our hospital survey about 75% of the beds represented. In our ASC survey, we have a much smaller percentage because it's a brand new survey, but we need all of them. You need to be able to access information about any provider that is offering an acute care service like a hospital stay or a surgery. Those are really important, and they're major investments for the public, and they're major investments certainly for purchasers. They need to be publicly available. So we're looking for 100% participation. And in the St. Louis area, you have about half of the hospitals that you ask to participating. So you have another half that you got to go out there and get in your community in order to make sure that the people in your area have the information they deserve about how the hospitals are doing. In addition, it helps the hospitals. Many hospitals may not see it this way every time. Some do, but it is really helpful to have that information available to you on how you compare both nationally and regionally on really critical measures of quality and safety. So it gives them information, it gives them a reason to be galvanized, it gives them the attention of their community, usually in very positive ways. So I think it's really helpful to the hospitals and the ASCs and to the people in the St. Louis area as well as nationally for us to have this level of transparency and candor about performance. That's the number one thing we want to see happen in the future. We are also looking ahead at other kinds of facilities we might be able to collect information on that can be reported and can be made available. So we're interested in looking at other facilities like nursing homes in the future. This is not something we're immediately pursuing. We are really focused heavily still on hospitals and ASCs because they're so important, and we're not there yet. But we certainly will be looking at other facilities. We also want to look at how we can continue to partner with other organizations to really push quality even further. One of the hallmarks, I think, of Leapfrog that we're proud of is that we're not a regulatory agency. We're not trying to say, well, here's the minimum standard for your performance in order to be given a license or given some kind of government imprimatur of you're okay. We're not after the bottom standards. We're not saying this is the bottom line. We're saying we are after excellence. The US pays more for healthcare than any other country on earth. We deserve excellent, top-notch healthcare. And that's our standard. That's the standard Leapfrog sets. That's the standard that every purchaser wants. That's the standard that every American wants. Excellent healthcare. So excellence is our standard. And we're going to continue to work. We're going to work with other partners who also seek excellence to try and keep those standards front and center as we move forward, both in advocacy and in our own work collecting data. We're going to go for excellence, and that's going to be that's the next 20 years. We're going to get to that stage where we can all depend on any hospital, any ASC that we visit will be excellent. All of them will be excellent. That's the goal.
I think that's such a wonderful vision and a great call to action for all of us. I know we here in St. Louis have been sending out letters, communicating with our health system partners about the importance of participating in the Leapfrog survey and reporting this data. But I just want to encourage all of the listeners on the line, regardless of which market that you are in, that you do the same. Connect with your local hospitals, see where they're currently ranked on some of these reports, and make sure that they understand the ultimate mission and why it is of value to patients, purchasers, and all consumers of healthcare, that we have the transparency that Leapfrog and others are trying to achieve.
Absolutely. And I would add one thing. I want to congratulate Mercy Hospital St. Louis is one of our top teaching hospitals from 2020. So congratulations. You do have some outstanding quality and safety in your community. You also have 8 hospitals ranked A from Leapfrog. And so you have some great examples, and I would certainly encourage all of your listeners to go online to leapfroggroup.org or hospitalsafetygrade.org and take a look at your region and take a look at your hospitals, because there's really some excellence there, and you should acknowledge that. That's really part of it, is for us to acknowledge excellence, recognize excellence. If there's nothing else that we can accomplish as part of this movement, that's the number one thing. We need to recognize it, because it's not easy to get there. We saw with the pandemic just how hard it is for healthcare workers and the healthcare industry to really be there for us always. So let's recognize their excellence.
Well, Leah, I just want to thank you so much for, again, joining us today and sharing your insights. We really do appreciate the important work of the Leapfrog Group in driving higher value healthcare and informed decision-making, and we are looking forward to supporting your mission for the next 20 years as a regional leader. As we close today's episode, I just wanted to ask if there's any final words that you'd like to share with our audience.
Well, I just want to thank you at the St. Louis Area Business Health Coalition. It's been great to work with you. We've learned from you, and we're excited to work with you as well in the next 20 years and to create a better healthcare system for your community and for the country at large.
Thank you for listening to the Be Health Connected podcast. For additional episodes or to learn more about employer resources available through the St. Louis Area Business Health Coalition, please visit www.stlbhc.org.